Hey guys, I'm Sebastian. This is
Done. Start over. I don't like that. No.
No, I'm not going to start. Let's just keep going. We're locally world famous chiropractors in Huntington Beach. We specialize in working with low backs, and so Dawn likes to call us
locally world famous.
She likes a jingle. She thought it would be cute, very cute. And so we're going to cover how to modify an exercise today called a good morning. And I know we know a lot of people have back pain associated with good mornings, after good mornings, during good mornings, sometimes in the morning doing good mornings.
There you go.
Yeah.
Nice.
So we're going to show you how to modify that today. By the way, if you're looking for more on figuring out how and why you're having low back pain, we have a bunch of other videos on this kind of stuff. So please go to our channel. It's a little red dot. You can subscribe there and just go in and check out what we have to offer you. There's great videos that explain disc herniations, pinched nerves, back spasms, all that kind of stuff. So just go through there and check all that out.
Cool.
Show me a good morning. All right. So come on back this way. We'll jump on the other side of the bench. Great. Okay. So I'm going to creep up here just so I can see what Dawn's doing, but in the camera. Okay. So she's got a good morning going. Dawn, does your back hurt with that?
Yes, it does.
Apparently her back hurts with that. So one thing we can do, the first thing we can do is just kind of assess to see what her movement quality is like and if she's really given her spine a chance. And so Dawn, show me one with poopy posture. Yeah, not good. And show me one that's actually good, but it gets poopy when you try to get too low. Yeah, that's perfect. And so I'm going to show this with the spine on her. Come close over here. So that's a perfect one. People unknowingly do this one. And so we're going to put this right on her. Good, 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 bad. Okay? Good, 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 bad. Okay? And so Dawn can't tolerate the range of getting a little lower with that. And so she's subjecting her spine to a little bit too much flexion, which is really kind of a pain in the ass when, especially if this barbell is loaded up. I know this is only a stick, so it's okay right now, but if that's loaded up, then that's a big no-no. And the easiest thing you can do is just be okay with just don't get as deep. Okay?
Nice.
That's my first suggestion.
Simple. It's always very simple, but if that doesn't work for you, there's more we could do. Tension cues.
Tension cues. Okay, what do we do next?
Show me your good morning, Seb.
Okay.
Be nice to you, Janaya.
Huge. Yeah, sorry, missus.
All right. Okay. Looks good to me. How does it feel?
My back hurts.
Okay. So tension cues is one thing that you guys may notice if you've seen some of our other videos we like to use for especially hinging movements like this. So I'm going to use the one with the bar here, okay? So some of the things that we try to do to protect the low back in these hinging movements is
I'll sit so they can see a little better.
1, lats, and 2, floor cues. I'm going to go over lats in this one, okay? So try to break the bar over your back there. What do you feel turn on?
I'm trying not to break it.
You're not going to actually break it.
My belly and my lats.
Okay, perfect. So I want you to keep that tension. So what he's trying to do is he's trying to break it down this way. That turns on your lats here, which will actually tie into turning on the core while you go through this movement too. Okay, so continue to break that over your back there as you go through that hinging motion and see if maybe that tension cue can help if you guys want good mornings as a specific exercise without it creating low back pain. Also, good mornings are not a low back exercise. You should not be feeling like you're getting a pump in your low back. I feel like some people may use this as like a low back strengthening exercise.
Yeah, they do.
It should be a glute. You should feel this in your glutes.
Yeah, it does work a whole extension pattern, but it shouldn't isolate that much into the low back.
Mm-hmm.
So, yeah, good one. That's one tension cue. You want me to do the other one?
Sure.
Or you want...
No, you go for it.
I was going to do the seated.
Do the seated one then. Okay, so then I'll give another tension cue, okay? So if you guys like that one, you want a little more tension, then what we're going to do, Seb's going to stand up, okay?
They can probably see my feet here.
Yeah, I think so.
Okay.
So actually turn towards the camera for me. Okay, I'm going to take your stick away from you really quick. There is a seam in the floor right here in between your feet, okay? I want you to grab sticky gecko feet, grip the floor. Good, there you go. He gets nice and stuck, like he's almost stuck in the sand at the beach, okay? And I want you to turn your feet without actually moving, just create tension and try to spread that seam in that floor apart. Okay, stand tall for me and do that. Good. Spread, 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 spread. What do you feel?
Feel my butt cheeks.
Perfect. Put that on your back. Break it. Good. Spread the floor. And good morning. Turn so they can see your form. Spread the floor. break the bar, and good morning. What do you feel now?
I feel my butt cheeks and hamstrings.
Okay,
Okay.
I'm okay with that.
Yeah. Here's a hamstring. Here's a hip dominant exercise you're going to get the hamstring into. Probably the last thing, at least for modification, shoe and tension cues. I'm going to go modifications. I guess on my 2. It's supposed to be the 4 I guess exercises. So.
I think you need to talk louder.
Oh, I need to talk louder.
You're whispering.
Sorry. Shh. Okay, so the one that I will pick, I'll just show you because I'm already on the bench. We can just eliminate the knees and lower out of the equation because some people just, if you start eliminating joints, like you take the feet out, you take the knees out, not like to chop them off, but you just kind of eliminate them out of the movement, we can isolate the movement a little bit better into the hip. And so we can use all those same tension cues if we want to, but I'm going to lean forward and tell Don a secret.
No. I like it.
How dare he?
Make sure you can spread your knees wide too, because if you feel like you're maybe rounding this way, spreading your knees really wide to allow for that hip space in that one can be really beneficial too.
And also doing something like this to give you an idea.
That's a good one.
It's on the back of my head, mid-back,
Oh, my foot's cramping.
and butt crease. And at no point should it come off my butt, but it did. You want to show?
Yeah. So it should stay touching here and here the entire time as you lean. If you can't keep that, this may not be a safe motion for you as for right now, but at no point should you lose the contact on the back of your head and right above the butt crack there with that stick.
Yeah. Okay. Now you just look small in the picture.
Sorry.
So what if all those don't work? I still have back pain, Don.
Okay, so those are some of the things that we would use in office to try to help with some of those people who want to use this exercise without having low back pain. If none of those work for you guys, we probably need to regress it a little bit. Maybe we need to take this exercise away altogether. Try to see if there's maybe something underlying that needs to be resolved first, like an injury of some sort. Heal that, create a buffer around the area, then introduce this exercise back in to build up strength and endurance in that area. So one way that we can do that is virtually. We can do that virtually for you guys. If you want us to dive a little deeper into what is causing your low back pain, we can do that. Our office is also open at this time. We can do it in office. You just got to make an appointment with us. Come see us. We can help guide you. And also, sometimes people are like, oh, cues, they're working, but maybe I have a little residual low back pain afterwards. I need to know some other steps. Well, we have a free gift. You're good at explaining the gift.
Yeah, the gift is, it basically explains, hey, that worked. What now? And it's really troubling to think. I mean, I hate to think that you guys are going to have to work around back pain and with your lifting and your movements for the rest of your life. And most people don't have to. They just need a little bit of a step in the right direction. So you just need a roadmap. So a lot of times what we do in programming with patients is we do that exact same thing. We roadmap it, but we get to have the person in front of us. We get to be able to examine them. And then there's people who say, "What about if you had to guess?" Well, there's a little thing there if we had to guess, and so feel free to take a look at that. We
He's talking about something that might have popped up on this video.
Yeah, there's a little thing.
To be more clear.
Or a link in the description too.
Yeah.
So we keep changing it over time to see which is as we start to learn more and as we start to figure out what works best with everybody. So that's why we're calling it a gift and not specifically what it is, because it changes sometimes. So let's call it a prize. A prize. Sorry, I whispered. That's it for today, and like, subscribe, share, and follow. They don't follow on YouTube.
Subscribe.
Subscribe.
AKA.
We'll see you later.